Hi, this is Kim talking at my 12-week post-operative session with Mark. He hadn't seen me for a while, but he's been my physical therapist for the last 2 years. So Mark, now that you've seen me after and evaluated me now after having my SI surgery, give me your comments.
I see a lot better isolation today than I have in a year and a half of hip muscles, both acetabular femoral and femoral acetabular hip muscles working in sagittal, transverse, and frontal planes more than I had seen in the past. In the past, Kim suffered from so much hypermobility in her SI joint on the left side, more so than the right side, and hypermobility in her lumbar spine with hyperlordosis that all of her pelvic femoral stabilization exercises she tried to do, she compensated with ilium movement and hyperlordosis and couldn't get to hip stabilization muscles that she needed.
Wow.
That was a mouthful.
That was a mouthful. But I just got done showing you exercise that you could see that I now have the ability to connect better from my left side, my right side of my body, in my layman's language.
You've got way less tone in your hip flexors, your TFL, and your psoas. Way less tone in those muscles, and also in your ER muscles in your left hip that are not causing you so many problems. Now you have less tone in those muscles pulling on you into places that were destabilizing your hip and lumbar spine and SI joint, and you can focus on more stabilization from proper muscles like your internal obliques, transverse abdominis on the left side, your adductor magnus on the left side, your gluteus medius is an internal rotator on the left side.
Cool. Well, thank you for the formal explanation of me trying to say to everybody, and my simple way of saying is that I feel the ability now to, like I said from the beginning of my other videos, is I can stand on my left leg, or I can connect more equally, so that the foundation I'm standing on is what I call a firmer foundation. And now I can say at 12 weeks since my surgery that all the exercise I've been doing for the last 12 weeks has been upon a good building block, as compared to the previous years. I was always trying to build 5 steps ahead, but would go about 10 steps behind. It was a roadblock, yeah. But now I think, Mark, you could perceive or agree that from not seeing me for several months now until now where I'm at now, and you're reevaluating me, you would agree that I now have a foundation I could truly move forward on.
I agree. I agree.
Well, thank you, Mark. Again, Mark with Pinnacle Physical Therapy, Post Falls, Idaho. Thank you.